Welcome to our channel, The Treatment Plan, powered by Treatment Possible. Yes, this is where we talk about how we can help you to make your treatment possible. We know healthcare decisions are not just financial but also an emotionally draining experience. We help you to understand how our body works and how it impacts our health. Stay tuned and enjoy this podcast.
Welcome everyone once again. Today we have Dr. Rakesh Rai, who is a Bombay-based liver transplant surgeon and a hepatology specialist. And he is heading two of the most prominent hospitals in the transplant program. He has his experience in renowned hospitals back in UK, USA, Korea, and Saudi Arabia. He has published his research articles in international medical journals and has delivered lectures in different countries. So we are very pleased to have you with us. And today we are going to talk about a subject that many of us are not that well informed, and that is liver. Compared to kidney or say heart, which is very prominent, by and large, people are not well informed or more aware about liver. So, sir, to ask you first, can you tell us the importance of liver to a human body?
Thank you, Leo, for inviting me for this important discussion on this very important topic. As you said rightly, that although as a clinician we know what the importance of liver is, but probably in the media the more space has been given to heart and maybe the people hear it commonly about kidney transplantation. So a lot of people are still unaware of the significance of liver in the human disease. So to start with, for information to the general public who are not into the healthcare, I'd like to say that it's very important to realize that liver is one of the largest organ in the human body. And it's not only large from its size point of view, it's large because there is a reason. And the reason is that the complexity of its mechanism of action, the different variety of functions which it carries to the human body is not done by any other organ in human body. And that's how the liver manages so many different functions which are vital. And as you and most of the people have realized that with the deteriorating function in your liver, finally your survival is at stake. So that's how the liver is one of the most vital organs.
Yes, sir. So as you said, it performs many functions. Can you throw some light on some of the important functions that a liver performs? Like for heart, we know it pumps blood into our body, which helps in carrying oxygenated blood throughout the body. But liver has been always, it's been a very complex subject. Not everybody understands what liver actually does.
So, as you said, the function of the liver is not a single or not two or three function. So that's why understanding of its function becomes very complex, because liver does a lot of different variety of function. To make it simple, I will just give you certain example that we divide the liver function into different components. Like we say that liver has got a synthetic function, liver has got metabolic function, liver has got excretory function. So, these may be just the wide category of division of the type of function, but even in each category, liver does so many things. So just common example I'll give you, everybody realizes protein, we have got a lot of proteins in the body, but protein synthesis happens in the liver. So if you see the synthetic function of liver makes lot of very important protein. Like, you must have heard about albumin. Albumin is a very important protein in our body. Liver forms the albumin. Blood clotting factors. All the blood clotting factors are proteins. They are again synthesized in the liver. So liver manufactures and synthesizes a lot of different components in the human body. Similarly, if you come to excretory function or filtration functions, lot of circulating poisonous material in our body passes through our liver, and the liver filters them out. Either it filters them, or it changes their chemical character so that they become less poisonous, what's called detoxification. So these are the other functions which liver performs. Similarly, there are a lot of metabolic functions, the whole of glucose metabolism, synthesis of other component which comes out of glucose, storage of glucose in form of glycogen. Whenever you need glucose, the liver again supplies glucose from the glycogen. So that a lot of complex and different functions, liver does. I have just mentioned few of them, the commoner ones, which probably the people will understand.
Oh, so sir, we will go on to the aspect that a layman like me would like to understand, and that is, what should I do so that my liver remains healthy? That is part one. Part two is, what are the indications or signs or symptoms which shows if my liver is deteriorating by any chance?
So there are a lot of simple things which we can do to keep our liver healthy. Okay. So first I will go into prevention of certain disease, which can be completely prevented if you take the proper action. So one of the most common cause of liver disease in many countries, and especially in India, is what we call as hepatitis or viral hepatitis. So there are certain group of viruses which can enter into your body, and they prefer to get accumulated in the liver, and they start damaging the liver. These are called the viral hepatitis. Now, the good news is that we have made significant progress in prevention and treatment of these viral hepatitis. So now we have got vaccine to prevent hepatitis B and hepatitis A. So first and foremost is that now you have the ability to take those vaccines and prevent hepatitis A and hepatitis B happening. So that is a tremendous opportunity which we have. It was not available 20 years or 30 years ago. So similarly, so one step is prevention. You can get vaccinated and prevent two very common viral hepatitis. Now the other thing is, there are certain toxins which are known to us that they damages the liver. One of the most common is the alcohol. So once we know that alcohol damages the liver, we have to be careful. We have to decide, we have to think about ourselves. Do we really need to drink alcohol when we know that alcohol can cause damage to the liver? So people always keep asking me, how much can I drink? It's very difficult to say, how much will you drink and you will remain safe, So all this data about how much you can drink has come from the Western society, because, the drink is part of their culture. And second thing is, how much alcohol they can tolerate. It may not be the same similar application to individuals in India. So my advice is, if you can survive without alcohol, the best thing is to stop drinking alcohol. Similarly, whenever you are taking any medication or you are taking it for long term, you need to discuss that with your doctor, because certain medication can cause injury to the liver. So you have to be cautious. Now, the problem in our country is that a lot of medications are available without any prescription. Okay, and even some important medications which can be dangerous can be taken without medication illegally. So people have to be careful in self-medicating, especially in COVID period. We all have seen that everybody has got its own prescription. People don't even go to the doctor, they start treating themselves. Next is about your food habit. If we are healthy, your liver is healthy. That means if you keep yourself fit and healthy, if you take your diet, which is a balanced diet, if you keep your weight as per your height, so you remain in the proper BMI range of yourself, if you do not accumulate too much fat in your body, if you do not eat too much fatty food, all this can also help in keeping your liver healthy, because now almost there is an epidemic of a disease which is called fatty liver disease, where the fat starts accumulating in your liver and finally the liver gets damaged.
Fatty liver is something that young people are facing.
Yes.
This kind of this growing everywhere. Many people are coming up and saying they have been diagnosed with fatty liver, including those who don't enjoy or don't consume alcohol. So, what are the signs that we should look out for fatty liver? And a step before that, how do we avoid fatty liver?
Okay, so first thing I'll say that what you need to understand that what is fatty liver disease. Fatty liver is a condition where your liver has got excessive fat. Every body has got fat in his liver. Okay, so there are certain amount of fat which comes into the normal range in a liver. But when you start depositing excess fat, that fat can lead to inflammation of your liver. This inflammation will lead to injury, fibrosis, and finally it will lead to cirrhosis. Okay, so that's how the fatty liver can cause permanent damage to your liver. Now, earlier the data from fatty liver started coming from Western country, and we thought what we studied, and we thought that the people who are obese, who have got a huge amount of fat in their body, they are the people who develop fatty liver disease. But that is a misconception now, because
Okay.
from Indian data we know that you can be very thin and you can have a fatty liver disease. The
Okay.
second thing which you asked, which is very important, how can we know that we have fatty liver disease? That is the problem. Fatty liver disease is asymptomatic. You may have severe fatty liver disease and you may not have any problem. That by the time your liver gets damaged and you come to know, it's too late. So do not rely and do not wait for symptoms to develop to find out whether you have fatty liver disease or not. Okay, so that is the another point to remember, that fatty liver disease can be asymptomatic.
Oh, so sir, do you recommend a regular health checkup? And what should that health checkup be? Because as you said, and as we know, that there are a lot of young ones who are now suffering or who have been diagnosed with fatty liver.
So, we do not recommend, in general health checkup, because health checkup has got multiple components, but we know that there are certain group of people who are more likely to develop fatty liver disease. Okay, it doesn't mean that not everyone will develop, anyone can develop, but if you are overweight or obese, if you have got diabetes, if you have got hypertension, a family history of, cirrhosis because of fatty liver disease, these are the people who are more likely to develop. So if you fall into any one of this category, so even at young age, probably there is no harm, getting your liver checked up to find out whether you have got any excess fat or fatty liver disease in your body or not. So that's what you need to remember. So these are what we call as kind of predisposing factors. So obesity, hypertension, diabetes, if you've got high fat in your blood, hyperlipidemia, they are more likely to develop fatty liver disease, but otherwise anybody can have the fatty liver disease.
So you're saying that those who have other comorbidities, they're at
They
risk
need to,
compared
yeah,
to
they
others
should,
who
yeah,
don't have any of these comorbidities. Great, great. That
yes.
was a great bit of information. Now coming to information that is very vital for people like me and those who others, those who enjoy alcohol on a regular basis. Now we would like to understand, because we have come across cases where those who hardly consume any alcohol, they have also been detected with the liver cirrhosis, which was caused by alcohol. And there are few other people who are what we call barrel, who can gulp down liters and barrels of alcohol, and still the liver stays healthy. So how do we have a right perspective of it?
So that's why I said in the beginning that there is no fixed amount, to say that you drink only 2 units in a day and you will be fine. As you rightly said, there are people whose alcohol metabolism is different. They may drink excessive alcohol and they may not develop for the long time liver disease. And there are people who may not be drinking as much as the other person, but they may have liver damage. So there is no clear-cut distinction or guarantee that if you drink only this much, your liver will be healthy. Okay, so the best thing is to avoid alcohol as much as possible. Okay, and if somehow you cannot stop drinking, or if you are drinking and you are thinking you are drinking just a little alcohol, probably 2 to 3 units in a week, even in that case you have to be aware, and probably it will be a good idea to frequently get it checked that whether your liver is suffering from any kind of injury or not. And from your previous question, understand that alcoholic liver disease and fatty liver disease are completely separate things.
Separate, yes.
Completely separate. So that's why we call as non-alcoholic fatty liver disease, or NFLD. So people who do not drink alcohol, they develop fat and damage because of excessive fat, which has nothing to do with alcohol.
Okay. All right. So it's very complex, where we can't pinpoint the cause, but we all need to be careful, because the kind of load that we are seeing, the patient load, people who are suffering from liver ailment, especially at a very young age, is something that is alarming the medical fraternity as such. So we also wanted to ask you one thing, that they say that weight loss or weight gain, a lot is dependent on the metabolism, which is again dependent on the liver. So they say if you have a healthy liver, you maintain your weight well. So how can you explain that to us?
So as I said, once you start developing excessive weight, most of the time this excessive weight which you gain is because of the fat accumulation. Very rarely in case of bodybuilders or athletes, they may gain weight, but that's because of muscle development. But when you are gaining weight because of lack of exercise or some kind of diet which is increased in sugar and fat, then you develop excessive fat, and this fat also starts getting deposited in the liver. Okay, when you lose weight, if you start taking proper diet and exercise, you start losing weight, and this weight loss is because of loss of fat. So a lot of people who have got excessive fat in their liver, once they lose weight, they will also lose fat from their liver, and their liver will improve.
Oh, that's interesting. So you have been mentioning a lot about diet, sir. So what is a diet that will keep our liver healthy? What would you recommend?
So it's very simple. We do not need to go for any fancy diet. We need to remember that there are 2 or 3 things which are injurious to our liver. One is the fat. Okay, so we need to avoid excessive fat in our diet, and we need to avoid excessive carbohydrate or processed sugar in our diet, because this sugar also goes inside the body, get metabolized, and excessive sugar gets changed into fat. So if you start avoiding fat and sugar or processed carbohydrate, your fat in your body will start going down. So you increase protein, you take less of fat and less of carbohydrate and sugar, and that's how, and along with the exercise, and that's how you will keep your liver healthy.
Oh, great, sir. So, folks, you heard Dr. Rai himself saying that to keep your liver healthy and to keep your weight low, or if you're trying to lose weight, there's 3 simple things that you need to avoid. One is sugar, one is processed carbs, and the third one, I sorry, sir, I missed one. Which is the third one?
Fat.
That we should.
Fatty food.
And all the food that contains fat is supposed to be very tasty. So, which means it will take some amount of sacrifice on our part if we have to maintain our health to be healthy and keep ourselves fit. So, sir, these are the basic issues that we face every day. With your experience, what kind of disease, liver disease, are you seeing today more, especially in the urbanites, those who are working 9 to 9 kind of a lifestyle? What kind of disease do you see?
So see, being a specialist with interest in liver disease, so we see a spectrum of disease because people come from far and wide. But we have definitely noticed, rapid increase in incidence of fatty liver disease, even in young population. So all these young people who are working in offices and, they are kind of sitting job, they are not very active. A lot of them are developing fatty liver disease at a very young age. And these fatty liver disease are getting diagnosed because through their company, they are getting annual health checkup done, and suddenly they found, oh, the ultrasound scan shows that you've got a fatty liver. So fatty liver incidence has increased significantly. The second thing we have also noticed, as even in Indian culture in cities, now the habit or this tendency to have regular alcohol drink has increased even in the young crowds. So that's why we also seeing alcohol related liver damage at earliest stage. Other than that, as I said, we see a spectrum of disease caused by viral hepatitis, autoimmune liver disease, liver cancers, and all kind of liver disease we see. But these two are very important to consider: increasing incidence of fatty liver disease, because these are lifestyle disease, so we can avoid that. And the second thing is alcohol related liver disease.
Okay, so with these cases increasing, it's our responsibility to ensure that we do our best and avoid what can be avoided. And if it's a disease which is not something that has been caused by our action, then it's very critical that we take treatment at the earliest stage. Because with liver, so I remember you once telling me that after a certain stage, it's difficult to reverse the damage that has been caused to liver.
Yes,
That's
yes. So the
particular
that
about
is
liver.
right. That is right. So the liver damage, which has been going on slowly inside your body for a long time, they go through different stages of damage. So probably in early stage, if we can identify the problem, we can identify the cause of the liver damage and we remove that factor, then the liver damage can be repaired by the body itself. But after a certain stage, damage done is damage done, and none of the medicine can improve or repair that kind of injury. So that's why early recognition and proper treatment is very, very important.
That's Thank you, sir, for that information. So going ahead, sir, if we have to look at patients who are suffering from liver diseases, and many have to undergo surgical, especially if it is a liver cirrhosis, which slowly progress into a liver failure, or if it's Wilson syndrome disease, which is again causing failure of our liver function, or alcohol-induced liver cirrhosis. So, what are the options available? I mean, is transplant the only option, or resection, or removing a part of the damaged liver? How do you decide on what that should be done?
So, as I said, there are a spectrum of liver disease. Some of the liver disease can be treated by medicines. Some of the liver disease cannot be treated by medicine, where there is only treatment available is some kind of resection. Like if you talk about liver cancer, once you have a liver cancer, then medicine does not play any significant role. And the best possible treatment is you can remove that part of the liver which has got a cancer. But some kind of liver disease, like you may have mild hepatitis, which can be treated with medicine. And then there are other spectrum of liver disease, which is cirrhosis and decompensated cirrhosis, where liver function is very, very compromised, and liver has got irreversible injury. None of the medicine can help. So finally, in those kind of decompensated cirrhosis, the only option is to change the whole liver. You cannot change the part of the liver because the whole liver is damaged. And those are the group of people who will need liver transplantation. So treatment of liver disease can be, medical, can be surgical resection, can be transplantation. And, in between, there are a lot of other options available as well. So you have to fine tune that. You have to select the patients who will benefit from each one of them.
Okay, that's great. So thank you, sir, for your time. Thank you for giving us more information on liver, how to maintain a healthy liver, at the same time what we should look out for and what we should avoid. In our next episode, we will talk to Dr. Rai and try to understand how a doctor or a specialist like Dr. Rai treats a liver cancer. And also we will understand the liver transplant procedure and who can be a donor and who cannot be a donor. Thank you very much for joining us for the first episode. Thank you, Dr. Rai.
Thank you very much. Thank you.